In this video, we are going to discuss about MAXTRA Syrup. We will be discussing elements like why it is used, to whom it is prescribed, its consumption, and various side effects. Before starting with the theory, let me tell you a brief about this syrup. MAXTRA Syrup is a highly efficient antihistamine which works by blocking the action of histamine in the body. It is used for relieving symptoms of sinus pressure, sinus congestion, runny nose, itching of the throat and nose, watery eyes, sneezing due to upper respiratory infections, hay fever, and allergies. A chemical known as histamine is responsible for causing allergic symptoms in the body. As it is an antihistamine, MAXTRA Syrup decreases or blocks this chemical in the body, hence relieving us from the symptoms. They selectively inhibit the peripheral H1 receptors, thereby reducing the histamine levels in the body. This medication is generally prescribed during common cold symptoms. Side effects of the syrup include dizziness, anxiety, constipation, nausea, blurred vision, and dry mouth. You may take this medication with or without food unless specifically mentioned by doctor. The course of the medication must not last for more than 7 days as it is only to give you some reprieve from the symptoms. Warning: please do not take this medication without consulting your physician.